Hello.
I'm gonna sit over here so that I can be on the camera with you.
Okay.
How you been?
I'm good.
You good? You got a big smile on your face.
Yes, another day.
Okay, so you're actually here for a physical and you're having some issues with a new job?
Anxiety.
Yeah, how bad is it?
Oh my God, it's so stressful.
Yeah.
I'm a leasing manager at an apartment complex.
Oh yeah.
Yeah.
Do you get to drive a golf cart around?
Oh God, yes. Yes, yes,
Do you
I have to walk
Do you ever
around.
want to like go around the corner and just kind of give them a little push?
Yeah, I
Oops.
do. I do. It's draining.
Okay, so do you get palpitations, racing heartbeat, dry mouth, blurry vision, tingling, numbness around the lips, things like that?
No numbness, but I get all those other symptoms.
The other stuff. Okay, and are you having trouble falling asleep at night?
Yes.
Has it affected your appetite at all?
Mm-mm.
Okay. All
But
right.
I'm waking up at 2 and I won't go back to sleep till 5.
Well, you're definitely having some anxiety symptoms. How long has this been going on?
Oh, some months.
Okay, so we're going to do a full set of labs on you today anyway because we're doing the physical, right?
Right.
So one of the things that we're going to check is your thyroid because it can kind of contribute to some of those symptoms, although I think this is pretty clear that you're having anxiety.
Okay.
Have you taken anxiety medicine before?
No.
Okay. All right, so I'm going to give you a medicine that you can take every day,
Okay.
and it should reduce the amount of anxiety that you're having.
Okay.
Now, generally speaking, people that experience external anxiety like this, they only seem to need a medicine for 6 to 9 months. They don't need it longer than that.
Okay.
Some do,
Mm-hmm.
all right? So the important thing is if the medicine is working well for you and you like the way it's working for you, you can stay on it.
Okay.
If you're one of these people that doesn't want to be on any more medicines, then you absolutely have to, which I guess we're all kind of that way. But if you're one of these people that doesn't want to be on a medicine, then there's a good possibility you won't have to stay on the medicine.
Okay.
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 And since you've not started anything before, I'm going to start you on a low-dose medicine called Paxil.
Okay.
All right.
Okay.
And take it at bedtime,
Okay.
if that's convenient for you, or you can take it during the day.
Okay. Perfect.
So whatever works for you, but we'll start you on 10 milligrams of Paxil.
Okay.
And what I'm going to say is if the medicine's working great, then we won't need to follow back up with you for a few months.
Okay.
If the medicine's not working great, you're going to give us a call and we'll try something else.
Okay.
You don't necessarily have to come right back in.
Okay.
There are other
Perfect.
medicines that we can use.
Okay.
All right, do you experience, besides what we've been talking about, any chest pains or shortness of breath?
Just a little shortness of breath, but
With,
I'm not past it.
Okay,
Yeah,
when you
with
get the
anxiety.
Okay, all right.
Mhm.
But otherwise, like when you're going up a flight of stairs or something, you don't get, okay. All right, and let's see, how about any bowel problems other than what we've talked about? Okay, do you experience heartburn or reflux 3 times a week or more?
Yes.
You do?
Yes, I was wondering what that was.
That's very important to know because if you're experiencing reflux 3 times a week or more, you're actually causing damage to your esophagus.
Oh, wow.
You can develop a precancerous condition called Barrett's esophagus, which can be very serious. So I need to treat that for you.
Okay.
So I'm going to put you on an acid blocker, okay?
Okay.
I'm also going to have you blow into a bag and we're going to do an H. pylori test and check you for a bacteria that can cause some of those symptoms.
Okay.
Okay, so you order that. H. pylori breath test. Takes a few days to get the results back, but it's a really very sensitive and specific test. Okay?
Okay.
And if it is positive, we can treat it, and usually it helps.
Okay.
Okay, but I'm going to start you on an acid blocker called omeprazole. It's a really good one. It's generic, and you take it once a day. The thing to remember about it, it does not work on the same day that you take it. You have to take it regularly for it to work.
Okay.
So you can't skip it, and then when you
Right.
feel it, take it. Because by the time you're feeling the reflux, the damage is done.
Right. Okay.
All right.
Absolutely.
Okay, good. Any urinary tract issues? Okay. Now you're 40. Have you had your first mammogram?
I haven't had it yet. I'm going on the 14th.
I can order it for you, but if you've already planned to see
Yeah,
GYN,
I
you
planned
can
it.
do it. Okay, that's fine. We'll leave that out. Okay. Let's see what else. No smoking history?
No.
Okay, good. So you don't need a chest x-ray, but we will do the EKG. We're going to check you for diabetes. We're going to check you for kidney function problems, liver problems, blood count and platelets. Make sure you're not anemic. We're going to check a vitamin D level. Everybody in Houston's vitamin D is low just about. Okay,
Yeah.
but we're going to get a level on you.
Okay.
And we're going to check you for gout. All right, hyperuric acid levels. Eat a lot of animal products? Okay, so if you're a carnivore more than an omnivore, if your uric acid level is elevated, then we like to keep that down so that it doesn't lead to kidney problems or gout later on. So we'll be looking at that. We're also going to check your thyroid, and we'll do the full thyroid panel, not just the TSH, and we're going to get a lipid panel, cholesterol, HDL, LDL, and triglycerides. Okay, so that's a pretty standard set of tests. You want me to check anything else in particular? Any concerns? Family history problems that you're worried about?
No, well, I mean, not really. I know my grandmother died of cancer. She had
what kind of cancer?
Ovarian cancer. Yeah, ovarian cancer.
Okay,
yeah.
So you're going to see GYN and have your women's exam, so that'll be fine. Okay. All right, and so we've covered most of the stuff. You have a special form that your insurance wants filled out. We don't need to do that on video.
Okay.
Can I use your real name?
Brandy.
I can use your real name on the video.
Sure.
You okay with that, Brandy?
Sure.
All right. Well, Brandy, that's awesome. Okay, so let's have a look at you here.
Okay.
Now, are you exercising too?
I am.
You look like you have some muscle tone on you here.
Oh yeah, they're sore too.
A little sore. Do you get swelling on your ankles here sometimes?
I used to, not anymore.
Okay. I see you've got some little marks, like you might have had some swelling, but it shrunk back down some. Are you putting some Aquaphor or something on here?
Yes.
Okay. All right. Do you get swelling at the end of the day? Do your ankles kind of puff up?
If I walk the property a lot.
Yeah.
But I mean, as soon as I get home and I elevate my feet, it goes down.
Goes right away. Okay. Do you drink a lot of diet sodas?
No, I drink water.
You drink
alkaline water.
Okay. All right. So you're not into a lot of high sodium foods and waters? Okay. All right. That's good. Waters. Plural waters. She's a waterer. Okay. All right. Just listen to your heart.
Okay.
Yep, it's ticking.
Really?
I want you to take a deep breath and hold it. Perfect. Now you can breathe normally again. Tilt your head back just a little bit. You have a little mole right there. Has that changed? Been there a long time? Okay. Deep breath. Blow it out. And again. Good, perfect. Okay, I'm going to have you lie back on the table here, so this will be a little tricky.
Okay.
But we're going to do this. There you go, lie back. Bring your knees up just a little bit, not a whole lot, just a little bit. Well, a little bit more than that. Okay, and put your arms at your side right there. Now, do you get any belly pains? When you eat greasy or fatty foods, do you get nausea sometimes?
Yes, I do get nausea.
Okay, and is that associated with the reflux that we were talking about earlier?
Yes.
Okay. Heart over in there. Deep breath. Good. Breathe normally again. You get pain down in there or over there?
Yeah.
Sometimes down here?
Yeah.
How often?
Not very often.
Have you ever noticed that it's associated if you eat popcorn or nuts or seeds or things like that? Okay. All right. Have you ever seen blood in the stool or anything like that? Okay. All right. That's fine. You can sit back. Swing your legs back over this way. All right. Well, your heart sounds great. No murmurs, nice and regular. Your lungs are clear. No carotid breweries. See, I need practice. Practice with the language. Either that or I'm thinking about a brewery. Right. No breweries. Okay, I do have bad news for you though, and it's not super bad news, but you are technically stage 1 obese.
Really?
I know, right?
Wow.
Because you look so fabulous.
Wow. You know what? I figured I was overweight. Yeah. I feel like I am. How much I weigh?
Well, do you want me to say it? We are live here. Well, we're not live, but we're on again. Okay, you're 182 pounds and you're 5'4", is that correct?
Yeah.
Okay, so that puts you at 31.2 body mass index, which actually is categorized as stage 1 obese.
Yeah.
Yeah.
Let me get rid of that.
Yeah, you're, but this is very typical for the American diet, okay? And it's not entirely your fault. It's what we eat. And this has become the new normal. 60% of Americans are at least overweight or obese, okay? So you're not terribly abnormal as far as the population is concerned, but compared to what our body mass index might have been, say, if we were alive in the 60s, you and I would both be thinner, right? Right. All right, so, I would work on losing about 30 pounds, maybe a little bit more. You could do that. It would certainly decrease your risk of cancer, heart attack, stroke, blood clots.
Okay.
Okay. Things like that. And I think there's even a link with memory problems and dementia with being overweight. So you're just 31.2. So if you lost about 20 pounds or so, you'd probably fall just into the overweight category instead of the obese category.
Okay.
Which would be an improvement.
Okay.
All right. I think we're ready to draw some blood and do an EKG. What do you think?
Yes, that'll work.
All right. And then off camera, I'm going to fill out your form for you, and I'm going to give you these 2 prescriptions. One is the Paxil, the other's the omeprazole. And remember, if you're not doing well with either one, you give me a call.
Okay.
Well, you were a lot of fun, Brandy. Thanks for letting me record this.
No problem.
It's good practice from me.
Yes, it is.
Oh, you're awesome.
Thank you.
All right. I'm going to turn it off now.
Okay.
Hey folks, you spoke and we listened. Here's what you had to say about Meta 7.
I love it so much. It gives me so much energy during the day.
I've noticed a change in my hair, my nails, my blood pressure.
There's no doubt that it's a benefit to me. It gives me more stamina.
And it could actually help you lose weight.
Now, I haven't taken a nap in 6 months.
That's right, Meta 7. More and more people are sending in their testimonials. Weight loss, more energy, and generally feeling more alert during the day. Let's hear more.
I used it to help wean myself off caffeine and energy drinks, and my productivity has been very high lately.
It's natural, it's amazing. I feel motivated to get out and do things that I didn't before.
I'm not tired during the day. I've worked 12-hour shifts.
Just go all day. It makes me feel great. I love it, and take it. It's wonderful stuff.
If you haven't tried Meta 7 yet, it's time to order yours from Amazon. Time to boost your metabolism and kick your energy level into high gear. There's an Amazon link in the description.